Assalamu alaikum viewers and welcome back to my channel Biodenverse Hub. Today we will be continuing the same previous playlist of oral pathology from the chapter of the oral ulceration and vesiculobullous diseases. So topic for today's lecture will be erythema multiforme. So let us have a brief intro about the erythema multiforme. It is basically an acute inflammatory condition, a dermatological disorder that is characterized by the extensive blistering and ulceration, and this could involve your skin, your mucous membrane, or even your internal organs as well. So, this was a brief intro. Now, let us move on towards the etiology that what are basically the factors that could result in the erythema multiforme. So, as far the etiology and pathogenesis is concerned, it is unknown, but we have certain precipitating factors that are as follow. First of all, any infection or any infectious agent could lead to this condition, and that involve the tuberculosis, the herpes simplex virus, both type 1 and type 2, mycoplasma pneumonia, infectious mononucleases, and histoplasmosis. So, all of these infectious diseases or the infectious agent could be the precipitating factors for erythema multiforme. We have another important precipitating factor as well, and that is the drug hypersensitivity, also known as the type 3 hypersensitivity reaction, that are basically triggered by taking the following drugs. That could be the barbiturates, sulfonamides, phenylbutazone, salicylates, or any oral pills. Another very important precipitating factor could be the hyperimmune reaction that could result formation of the antigen antibody complex against the submucosal and dermal blood vessels, and in turn it could lead to the erythema multiforme. So we have certain miscellaneous factors as well present that could be the precipitating factors for erythema multiforme, and that include the radiation therapy, any kind of radiation therapy, Crohn's disease, and vaccinations. So these were all the etiological or the possible precipitating factors for the erythema multiforme. Let us now move on towards the histopathology. Microscopic findings of the erythema multiforme are often non-specific, but we have certain findings, and that involves that the epithelium is edematous with the acanthosis that would lead to the widespread necrosis of your basal keratinocytes. Vesicles or bulla, they may form intraepithelial or subepithelially, they can be formed. Both are the equal possibilities. They could form subepithelially or they could form intraepithelially. Subepithelium connective tissue, it will show you the edema and the perivascular infiltration of lymphocyte, eosinophil, neutrophil, and macrophages. Again, a very important event that is basically triggered or manifested as a result of any inflammatory condition. And as we know that erythema multiforme, it was an acute inflammatory condition. So now let us study some clinical features. Clinical features involve that erythema multiforme, it occurs more frequently in the age groups of 15 to 40 years. And here, males are more affected. We will have a prodromal phase as well, and that will basically occur 1 week before the onset of the disease with the upper respiratory tract infections that could be fever, malaise, headache, or arthralgias. Its severity varies considerably. In its severe form, it could lead to the Stevens-Johnson syndrome, widespread involvement of the skin, oral, genital, and ocular mucosa. And we also have the ocular involvement, which could lead to the conjunctival scarring and visual impairment. So, Stevens-Johnson syndrome, it was a severe form of the erythema multiforme. Milder forms will involve the oral cavity with and without the skin lesions. Generally, the disease tends to subside within the 10 to 14 days. Recurrences are very much common, and it is associated with the recurrent attack of the herpes simplex virus. So we can also see some other clinical feature involving the skin lesions or the oral lesions. Now we will study in detail about the skin lesion and the oral lesion. So skin lesion, we have a classical dermal lesion, and that is a very peculiar and specific sign of the erythema multiforme. It is frequently asked in the questions in your exam, and it is frequently asked by the examiner who will be taking your viva, or it could be present as in your OSCE examination. We will also see some pictures as well of the erythema multiforme targeted lesions that would be shared with you in the video. So, classical dermal lesion of erythema multiforme, which often appear on the extremities, they are known as the target, the iris, or the bull's eye. The target lesion, they are basically the red macules of 1 centimeter or more in the diameter with a bluish cyanotic center. They often consist of the erythematous ring, separated by the rings of normal color on the skin. Basically, you will have a targeted lesion, and in that, you will have a bluish cyanotic center, and surrounding that center, you will have a lot of the erythematous ring, and that will give you appearance of the iris or any bull's eye. Therefore, it is also known as iris and bull eye. Hand and the feet are more commonly involved. Now, let us move on towards the oral lesion. The oral lesion may involve any part of the oral cavity, but lips and anterior part of the mouth are more commonly affected. The appearance of oral lesion varies with time. Erythematous patches, they are quickly followed by the vesiculobullous eruption. They radially break down into the erosions. The erosion on the lips, they are accompanied by the bleeding and the crusting. Circumoral crusting hemorrhagic lesions, they are the important sign for arriving at the clinical diagnosis, which means that if any patient at your clinic arrives with such kind of oral lesion and signs, so it is a very peculiar diagnostic feature that the patient would have the circumoral, which means surrounding your lips, crusting and hemorrhagic lesions out there. So now let us study the Steven-Johnson syndrome. It is a severe form of the erythema multiforme, also known as the erythema multiforme major. This condition is triggered by a drug. It is not triggered by any infection. This condition is just triggered by a drug. The widespread involvement of the skin, eyes, oral mucosa, and genitalia is seen in this syndrome. So let us have some brief overview of that. As the skin lesions are concerned, we have severe lesion of the macules, papules, vesicles, or bullae, etc., that will be found in any area of the skin. Eye lesions will involve the photophobia, the conjunctivitis, the corneal ulceration, uveitis, and blindness due to secondary infection. As far as the oral mucosal lesions are concerned, we will see very large vesicles or bullae. They will often develop in which they will rupture and leave the painful ulcers. Pain and hemorrhage will form the ulcer, and from the ulcer, the pain and the hemorrhage will cause the difficulty in eating food. Ulceration and bloody incrustation, they are often present on the lips as well. Mucosal lesion, they are basically self-limiting, which means they will heal by themselves, and usually the time frame is of 2 to 3 weeks. But recurrence is common, that we have studied earlier as well. In the erythema multiforme, the recurrence was very much common, and remember that it was due to the herpes simplex viral infection again. As for the genital lesions are concerned, patient will have urethritis, balanitis, or vaginal ulceration. So these were some lesions and manifestation of the Steven-Johnson syndrome, that is the severe form of the erythema multiforme, also known as the erythema multiforme major. It is frequently asked in the questions in your exam, and it could be asked from you in your vivas as well. So remember that. Now let us move on towards some differential diagnosis. If any of the scenario come with such kind of signs and symptoms and features, and you are asked about the differential diagnosis, so you can write the following: acute primary hepatic stomatitis, aphthous ulcer, pemphigus lesions, pemphigoid lesions, erosive lichen planus. So these were some differential diagnoses of the erythema multiforme. Now, as far the treatment is concerned, we will just have a brief overview of the treatment, and that is in this condition, it was basically self limiting and it just heals by itself in the 12 to 14 days. But you can also have the topical and systemic steroid therapy, plus, you can also give the antibiotics as well, depending on the casuistic factor. So, this was all about the erythema multiforme. I hope this video will be helpful for you all. Don't forget to subscribe to my channel and also click on the bell icon so you will get notified about our future videos and updates. Thank you.